people assume older adults make up a small portion of our population,
Mm-hmm.
and that is just not the case.
Mm-hmm.
It's not just this segment of people that is forgotten about or that is not significantly impactful. It's a large portion of our population.
I don't think I had any comprehension before I came to work in this role how many people really don't have anyone in their lives,
Mm-hmm.
or they have very few people in their lives and they endure treatment because they just don't know what else to do. They don't know
Don't have
where
any
else to
other
go.
options.
Right,
Mhm.
exactly.
Baby boomers, individuals roughly 72 years old and older at the time of this recording, made up close to 20% of the U.S. population in 2024. Yet, as one of our guests today notes, they are widely unseen for reasons we'll delve into today. This lack of visibility, or lack of voice, can lead to unique mental and behavioral health needs. Today, we welcome a very special guest who provides for us a refreshing view of care for older adults. We'll share some of the insights about mental health and aging from Life Senior Services President and CEO, Eileen Bradshaw. While Life Senior Services can provide individual help to you at 918-664-6000, today's episode is designed for a broad audience and is full of practical, actionable insights for older adults and those who care for them. We're happy to have you join us today on OK State of Mind, a podcast of Family and Children's Services. Well, welcome everyone. Today we're speaking about mental health in older adults, and we have a couple of faces that have been with us before and a new one. So let's just quickly go around the table and introduce ourselves. Eileen, we'll start with you.
I'm Eileen Bradshaw. I'm the president and CEO of Life Senior Services.
I'm Caitlin Foster. I'm the Vice President of Adult Outpatient Services with Family and Children's.
And my name is Tom Taylor. I get to be our Chief Development Officer for Family and Children's Services.
All right. We're glad to have you with us today, Eileen and Tom and Caitlin. It's good to have you two back. So I know you know your way around this, so it's good to have you again. So today we're talking again about mental health in older adults. And so I would like to start out by laying a foundation. Eileen or Caitlin, can either of you just give us tell us where we're at on mental health in older adults? What are we looking at here?
So I think before you talk about the specifics of mental health within the older adult population, you have to understand the gravity of the population that we're talking about in terms of numbers and just what that means to our community. The older adult population, when you say that phrase, people have different images in their head and they have different ideas of what it means to become an older adult. A lot of times that centers around fragility and loss of relationships, loss of mobility, loss of all of these different things. And that's not necessarily the case when you really dig into what does it mean to be an older adult.
Mm-hmm.
The other piece of that is our population as a whole is aging. And so it's not this very specific kind of isolated group of people that we're talking about. There's not consensus in terms of what the age is to be an older adult. Obviously, Medicare has its retirement age in mid to late 60s, but most researchers and social service agencies, when they talk about older adults, you're generally talking about individuals that are 55 and older. So that's a lot younger than what most people think it is.
That's exactly right. It's so funny what people consider to be an older adult is typically somebody 10 years older than them, no matter what their age is.
Yeah.
Yeah, and I assume some of the things that we're going to talk about today are affecting people well below the age of 60 years old. So, yeah.
I thought Caitlin was first pointing at me.
I'm not
She was
targeting
like-
anyone specific in this room.
Well, why is it important that we have this conversation about mental health in older adults now? Why is this an important conversation today?
I think in the research I've done since I've been at Life Senior Services, older adults are the least likely population. So in that specific context, 65 and over are the least likely segment of our population to seek mental health help. And yet 85 and older are the single most likely group to commit suicide. Second, I think it's 75 to 85. So, I mean, that's something I don't think most people know. So mental health challenges go across the ages, right? It's not the needs are different for seniors, and it tends to be an issue that gets swept under the rug.
Yeah. Why do you think they are not seeking help?
I think there's a pride element. I think depending on who we're talking about here, but if we're really talking about that 75 to 85, those are folks that have been really brought up on the, pull yourself up by the bootstraps ethos, and raising your hand to ask for help for anything is difficult. And mental health is something that wasn't talked about a lot. The younger side of older adults, it's been more widely discussed, but it's still, I think it's hard. And frankly, in a physician's office, you may be getting some pretty terrible news or discussing some pretty sad things, but most physicians just don't have the time to sit down and say, and how is that making you feel, Chris?
Yeah.
How do you need help in coping with this? I mean, those conversations just aren't really happening.
That's interesting, the pride aspect. And I wonder how connected to specific generations that is. I wonder if that arc is going to change over time as we roll into new generations becoming older. What are some misconceptions about aging, some general beliefs that need to be debunked?
I think that Caitlin hit it when you talked about the fragility. And I mean, that certainly applies to some people, but it's not universal.
I think another thing is that people assume older adults make up a small portion of our population, and that is just not the case. And we are living longer. I think Stanford did a study that said of all the 5-year-olds that were alive in 2022, half of them in the United States were likely to live to 100 years old.
Oh my gosh.
So as a whole, we are shifting, and we're shifting upwards in terms of our life expectancy, which is great. That also means that our older adult population is really growing. And so it's not just this segment of people that is forgotten about or that is not significantly impactful. It's a large portion of our population.
And it's diverse. So we're not talking about a blue zone where, everybody's eating this macrobiotic. They all have the same interests and they live in a little village. I mean, it's a very diverse group of older adults. And just like the population at large, you have extroverts, introverts, you have people with all kinds of interests and all kinds of abilities. And so when we talk about older adults, I think sometimes we picture Aunt B, and that's just not the case.
Right.
Are you finding this older adult population post-retirement and living longer is that they have to repurpose their lives in the second half of their life?
Yes. For some folks, yes. And it's really interesting, even something as sort of banal as a conversation with somebody wanting to volunteer. About half the people say, I've been an attorney and I want to go and put that career to use to serve the public in another way. I want to volunteer and review bylaws or whatever. And then you'll have somebody else come in and say, I'm an attorney. I never want to see a law again in my life. I wanted to be a florist, and so I will work on galas only. So some people want to completely do a reinvention, and some people just want to adjust course with the life that they've sort of built, which is kind of a spectacular opportunity to be able to make a choice on how you want to redeploy, how you've been spending your time.
I love that word, redeploy. Almost like a second chance to do what you want to do.
Yeah.
Yes. Yeah. It's can be just incredible. It can also be overwhelming, right? There's a gentleman named Charlie Baker who we work with in our volunteer program. He's got a retirement, it's called the Dream Chapter. And we've had a lot of conversations because he says we prepare so intensely financially for retirement, but we do not prepare emotionally for retirement. And that there, especially, I don't want to paraphrase Charlie, but he's been an executive coach for years. And sometimes the higher powered the role, the harder retirement is, right? Because their identity has changed. And so they've got a whole checklist. We work with retirees in a Give 5 program, taking them around, letting them explore volunteer opportunities. But the first part of that class is about what do you want it to look like, right? Like, what do you do have the autonomy to make your new path, but it can actually cause mental health challenges because it can be so overwhelming.
My mom has identified with that. You know, she retired 15 years ago, but like she's after having this social network that we are all so attuned to in the working environment, and then to not necessarily lose that, but it changes. You're no longer answering questions, and that you become an Anna, or no, you've always been that. But like your world changed, and she's like, it took her a good 5 to 6 years before her to come comfortable with that. So I've loved the what you mentioned about the mental health aspect of that.
It's real.
Yeah. Well, and this may be another misconception. I like what you were saying earlier. We kind of perceive older folks as Aunt B, but they're transforming just like any other age is transforming. They're continuing the constant state of transformation. And speaking for myself, I wonder if sometimes we think, oh, they're just steady. They're unwavering, but we're all going through transformation, and this regardless of your age. Caitlin, I want to go back to something you said earlier. We assume the older population is smaller than it is. Why would people think that population is small?
Some of it might depend on your environment and exposure. So as you're going about your day-to-day life, the older adults are not as visible in your world.
Yeah.
Some of that is because they have more time flexibility, and so they're out seeing the doctor and running errands during the day when I'm at work. And so there's that natural assumption of the world is made up of the people that I am familiar with and that I see on a regular basis, and that's just not necessarily true.
Yeah.
But I think by 2030 in the United States, people that are 65 and older, there will be more of them than people that are 18 and younger.
Oh my gosh.
And so, like
That's
I said
just right
earlier,
around
like
the corner.
it
That's
is-
right.
it's
Yeah.
it's 4 years away.
Yeah.
In approximately 4 years, and that will be a very large group of individuals in our country.
Well, what are some of the unique mental health needs of this population?
So I think one of the things that's important to recognize in older adults is their resilience and their perspective. They've been through so many different phases of life, and they have that gift of looking back and knowing that, yes, I can do hard things and this will not last forever. But in terms of needs, one of the major things that we see is just education, because mental health was not a hot topic or as accepted, as talked about. It wasn't something that it was okay to discuss when they were younger. And so the things that are popping up as what we would think of as mental health symptoms, a lot of times older adults express mental health needs physically. And so it comes out when they go to their PCP. It's that I am not able to get out of bed in the morning. My stomach is hurting a lot. I am just feeling very tired all the time, or my heart is racing. And you have to really be knowledgeable of that as a provider and be able to ask more specific questions about, like, what is this? Where is this coming from? Is this a physical need, or is this something that is more mental health related? So just educating and normalizing around mental health symptoms, because older adults are not exempt from mental health struggles, just because you get to 65 and you have all this perspective and you have all this knowledge. That doesn't mean that life is just breezy after that.
That's right. So it sounds like you're talking some anxiety here, like keeping him up at night or waking him up in the morning, or causing stomach problems or whatever. What about isolation? My stepmother, who I'm very close to, she's my last remaining parental figure. She just turned 91 in October. And I walk in and we sit down and she'll say something like, "It's been so long, since you were here." And I say, "Well, I was just here 1 week ago." And I suspect it's because she doesn't drive anymore. So if she gets out, it's her friends taking her or me taking her. So I suspect that there's just some isolation issues there that make her weeks very long.
I have a very similar situation in my family, and it takes you back. You're like, actually, I was here on Tuesday.
Yeah.
And I do think that isolation is the number one enemy to physical and mental health in seniors, and it's hard to avoid, because if they make the mature, safe decision at some point to give up their keys, then, it comes with some isolation, inevitably. Life Senior Services, we have an active senior center. And that sounds fun, like Parks and Rec, and it is fun.
Yeah.
But it has a real mental health support component built in. And we actually offer some transportation when we have the funding to get people there who don't drive anymore. We lost some funding for transportation, and the woman sent me a video, and it was her on her couch talking about the mental health changes she had experienced since being able to get a ride to the senior center and how fearful she was about us losing that funding and what the impact was going to be. It was really kind of amazing.
Yeah.
So, I mean, yes, our senior center can do that, but any sort of scheduled, defined interaction that you can make happen with a blend of transportation. We're not as much of faith-based congregational society anymore, and that has real ramifications for the senior population and socialization as well. If you have a senior who's still involved in their faith community, that really does solve a multitude of things. That if people are bringing them to church, people bringing them banana bread, all of that, that's a connection that a lot of folks don't have anymore.
Yeah.
Eileen,
how many days a week does that program run with Life Senior Services?
We are now open 7 days a week.
Oh, wow.
And we're open 4 evenings a week. So that was our goal with the new facility, was to get to be open 7 days a week, because we have a lot of working seniors that were like, I'd love to come do that, but I have a job, lady. So we've got this. The evenings are still not quite as populated. Like people will come to a specific yoga class or something, but they're not coming and hanging out in the evenings quite as much. So that's our next frontier to conquer.
Sounds good.
And I suspect that isolation leads to things like the anxiety that we were talking about earlier, or maybe even, more challenging mental health issues like depression and grief. Can you talk a little bit about those two things, the depression and grief in older adults?
So depression and grief, when you're looking at the specific criteria and as a clinician diagnosing, they have two very separate paths. They feel similar sometimes, and the result is similar. It can be, but they are two different diagnoses, and it's important to know the difference between the two. When you're talking about grief and bereavement, that is something that is surrounding typically one event, the loss of a person or a thing like your job or your home. You can grieve those things as well. It doesn't have to be just the death of someone close to you, but that's a very person or event-centric thing. And typically the feelings of grief come in waves, and you are tying that back to missing the person or missing the thing that you lost, whereas depression is just an overarching hopelessness, sadness, and feeling worthless about yourself. A lot of that happens with depression, and that's not something that we see typically in bereavement. A lot of times people that have depression have also experienced suicidal thinking or wishing that they were not here anymore, and that is generally not a symptom of bereavement. It could be, yes, that I wish I was with my loved one and I want to be with them, but it's not I want to die or I want to be dead.
Yeah.
So sometimes bereavement can turn into depression, though. And so that is really important to pay attention to, that this very targeted emotional response in bereavement doesn't then bleed out into every aspect of your life. And with older adults, too, you have to recognize that they are experiencing or can potentially experience loss after loss after loss after loss.
Yeah.
And so losing a loved one, how I might experience that is going to be very different. That could be an isolated event for me, but I still have all these other things. I still have family members. I still have a social network. I still have a job that I can come to, and I gain support from that. I have a support community. Whereas an older adult, they could be losing their entire family. They could lose their housing. They could lose their employment. And so at the end of the day, these support networks that other people that are other ages have, they're just no longer there anymore. And so every loss is just that much more magnified.
Yeah.
The miracle of compounding interest, sort of, we see that. And I think it's really great for you to delineate the difference. And so many people in a vocabulary term don't, because they'll say, I'm so depressed, I lost my husband. And they're going through grief, but that the, conflation of those two terms makes it a little bit harder for people to know how to support.
Yeah. I think it's a really important point that you make. They could be experiencing loss after loss after loss. And I think there is some melancholy that goes with that. How do we know when it's time to maybe start seeking help for our loved ones who are a little bit older, when it crosses from melancholy to depression, like where it's, really significant in their lives?
Right.
What can we watch for?
Crosses over into clinical depression. The symptoms of depression, they do look different in older adults. Like we were talking about earlier, they don't necessarily have the language or know the language that another demographic might have in terms of talking about depression and specifically using the word depressed. That's not a common word that we see in most vocabularies. So you're looking for other maybe sneakier expressions or symptoms that they're hinting at or phrases that they might use. It could be things like, do you feel worthless? Are you wanting to avoid social gatherings that you used to enjoy? Do you feel like things are never going to get better for you?
Yeah.
And so not using as much clinical language, but really trying to figure out, is there a difference in how you're feeling now versus how you felt 6 months or a year ago? Being able to use language that they understand and connect with. Because if you just ask, are you feeling depressed? Most older adults will tell you no. When they think of someone that's depressed, they'll think of someone that is crying all the time and not able to get out of bed and just that very stereotypical depressed person. This idea of functional depression is foreign to them.
Yeah.
The language that you use is important.
And I think you keyed in on behavioral things to look for. Like, you talk about your stepmother. If your stepmother suddenly didn't care if you came to lunch, right? Or noticed real changes in sleeping and eating. And I'm always a big believer, if you have any concern, it's better to just be wrong and seek some assistance and
that's a
have
great
be
point.
told, everything's great. So
Yeah. What about substance abuse? Do you all see much of that in the older population?
yes, sir.
It's a rising and highly concerning trend. The top substance that older adults use is alcohol.
Okay.
And part of that is because it's easily accessible. And you can find a liquor store on pretty much every street corner. And it's also socially acceptable.
Yeah.
And so that is the top substance use that you find with older adults. The second is opioids.
Oh, wow. Okay.
And that is, the opioid issue is real. And there is really troubling instances of people not really understanding the weight of the prescriptions that they have. We are familiar with scenarios where, there's a knock on the door. Hey, Richard, I'm out of my, pain pills. Can I have some of yours? I mean, in co-locating situations, that is not uncommon, and it's a huge problem. And we've had to have conversations about, do you understand that if this person dies taking your medication, that it's not only horrible for them, but you will be. But there is sometimes a lack of understanding in really what opioids, the power. And they're very commonly prescribed in the older population.
Yes, they are.
Does that go back to how we can educate the public and especially our PCPs on does this older adult need a opioid prescription or not?
Just a personal opinion, yes. I think that nobody wants to look at someone in chronic pain and keep them there, but I think a real evaluation of what options are on the table rather than just opioids.
Well, and to Tom's point, PCPs are seeing these older adults and they're thinking, they know how to manage this. That I don't have to tell them, don't share your medicine with anyone, but actually it may be, an important thing to do.
Well, it sounds like their caseloads are going to be getting larger and larger in the next 4 years as well. So
We've started to see there are a few different health organizations that have started to focus solely on the aging population. So I'm hoping that that also comes with increased awareness and knowledge around how different medications impact older adults physically, because there's also that changes over time as how your body metabolizes substances and medication, and so that puts them at increased risk, and that's not always widely known.
We occasionally see terrible news about situations of abuse taking place with the older population, but I suspect it goes beyond physical abuse. We see that's what we see on the news, but I assume that there are other types of abuse that Tom and I can watch out for with our aging parents. What else are we seeing in the realm of abuse with older folks?
Financial abuse is the thing that we probably see the most of. I mean, all abuse is terrible.
Yeah.
Financial is just, it's more subtle, and it can be from strangers, and it can be from people that they love and trust. We actually have a partnership with Domestic Violence Intervention Services where we have an elder abuse specialist. And I frankly was sort of horrified that we needed that, right?
Yeah.
And there's just more than I ever realized.
Well, I think that is such a great point. I will go over and talk to my stepmother, and she'll say, I got this text the other day, or I got an email the other day, and they were saying that they're from my bank, or they're saying that I'm behind on something, and she gets worried about
Yes.
that. And they know that that's how they can
Yes.
get them. If they say, you're behind on your payments, you need to click this link and get this resolved right away. So I think that's very real.
Right. And there's that space, especially with folks your stepmother's age and just a little bit younger, where it's great that they have the computer, and it's great that they have that way to stay connected. They're not quite tech savvy enough to understand what not to click. That's a real gray zone that we see. We're constantly trying to do education on, fraud and prevention. But I mean, somebody comes up with a new deal every day. And so,
And it's more and more realistic every day.
and banks are sometimes the first people. We get calls from financial institutions saying, we have a customer, and suddenly there's this younger person coming in with them that we've not seen before, and they're cashing checks and things. So financial institutions actually, and there's some very compassionate, savvy bankers out there that take the time to pick up the phone and say, can you connect with this person? We think they need some help.
Yeah.
that
great.
is amazing.
Yeah.
I know. It makes me, kind of moves me every time I get the call. It's a horrible deal, but I love the fact that people, and they're as busy as they are taking time to get to know their customers in that way.
Yeah.
In terms of financial abuse, like you were talking about earlier, one of the ways that we see that is also in partnerships where you have a couple that has been together for a very long time. Typically, more traditional gender roles are followed. And so sometimes it will be that one partner, typically the man, has the knowledge and the control over finances. And sometimes that can turn into abuse, sometimes not.
Yeah.
But it puts both parties just in a really bad position, because if he is controlling all of the finances and making all of the decisions, then the woman doesn't have a say in that. And then if he ends up leaving or dying before she does, she's also in a bad position again, because she doesn't know how
the
to
knowledge,
manage
yeah.
any of that, how to access and manage the finances,
Yeah. That's true.
and can be vulnerable a second time.
Yeah. What about the people taking care of older adults? I'm fortunate to have a number of relatives who help me, and so I don't think any one individual is getting overworked or overstressed, because we all do a nice job of sharing the responsibilities. But just seeing how the responsibilities, how many there are that are shared among half a dozen of us. I mean, if there were only one or two caretakers, I would imagine that would become pretty stressful.
Caretaking is incredibly stressful, and it is a privilege to care for somebody that you love. And that is 100% a gift in many ways. But two things can be true. It's also completely draining, physically, emotionally, and sometimes financially. And as many resources are out there for that support, there are folks that still can't accept it. That, they really don't. They feel like it's somehow disloyal. They feel like in sickness and health, they've taken the vows. I'm the only one that can get my partner to eat lunch. I'm the only one that can change their clothing. I get calls from people all the time, like, you need to get Judy to bring John to Adult Day Health, or you need to get, Eric to bring Betty, or and I can make those calls. We can extend tours. We can do, but people have to be ready. There's a real segment of the caregiving population that really does need support and has not felt comfortable accessing it. We have a caregiver support specialist on our team. Her name is Donna Mancini, and she's amazing. And that's all she does is caregiver support. So she'll do multiple one-on-one sessions. We have support groups, which are fantastic, but sometimes you need a closed door to fall apart a little bit. She's also started recently a men's-only caregiver support group, and that was based off of feedback that from a gentleman, saying, these ladies in this group are nice. I mean, God love them, but this isn't helping me, right? Like the issues that I'm having, just practical issues. Like, I don't know how to do my wife's hair. Yeah. And I'm getting criticized by her friends. So that has really taken off. And it was something that I didn't even know we needed to be doing, And so we just try to meet people where they are. But the statistics on the physical outcomes for caregivers are dismal. Quite often, they actually are outlived by the person they're caring for. So the effects and the impacts are tremendous. And we all know somebody who is a caregiver. If you're not yourself, any way we can encourage people to accept help, and any way we can extend help. If it's like, can I take, Joe to lunch, and maybe you can go take a nap or get a massage or just watch a soap opera? I don't know.
Yeah. Well, it's true. I mean, we're not educated to be caregivers.
Right.
It just kind of happens to us.
And sometimes overnight.
Yeah, that's right. Yeah, very suddenly, very unexpectedly. That's true.
It's great that you all have that support system at Life Senior Services to offer that.
Yeah.
Well, I just hate it when somebody says, I wish I would have known about that. I'm like, so here we are shouting about it, right?
Right.
Yeah. We have talked about, kind of the sad side. Let's switch and move over to what resources are available and how can we help? And it could be Life Senior Services, it can be Family and Children's Services, or just something that's out there. What's available?
So Oklahoma is actually fairly progressive in terms of compiling and communicating aging services that are available. Through the Department of Human Services, they have an Aging Services Division, and then Oklahoma Department of Mental Health and Substance Abuse Services also has an older adult division. They both have state plans and ways that they are addressing the needs of older adults, and obviously that's statewide. So just in Tulsa, we rely heavily on Life Senior Services and what they provide in terms of the caregiver support and the day services and the tax prep services, which we haven't even talked about, but it's a huge benefit to the community. And mental health specifically, Family and Children's Services has partnered with Life to provide free therapy and case management resources to the individuals that are referred by them. And so sometimes that's a great way for us to get connected because they're going to a community partner that they are familiar with and that they trust, and maybe they're going for day services, but an employee there recognizes, hey, I think this might be a little bit more than loneliness. Let's see if we can get your referral to Family and Children's Services for more in-depth work.
We are just so grateful for this partnership with Family and Children's because you all are the experts, and people do feel if they've come to get their Medicare reviewed or they've come to taxes, it's a familiar space. It feels a little less scary than making an appointment in a place they haven't been. So having your team with us has just been materially game-changing. we have case management, so we can help you fill out, your aid and attendance benefits, or we can help you find a place to live. But the mental health component is not what we do. But we come into contact with lots of folks that need the support. So it's been incredibly impactful.
And we've learned a lot through our partnership, and it's grown over the years. We've been in partnership together for 3 years.
I just remember
figure it
sitting on my
out.
bed working from home during COVID when we were having the
2022.
conversations.
Yeah.
So
It's evolved over
whatever
the
that time
years.
was.
Yeah.
We've added staff and really just been a wonderful partnership.
it's been great.
Well, what's one small thing that either an older adult or a caregiver or both could do this week to take a step toward improving any problematic situations?
Asking for help can be overwhelming. And so just doing that initial assessment of like, what do I need help with? Do I need help with housing? Do I need help with finances? Is it something that is mental health related, or am I lonely? And I need to find friends. So doing that self-evaluation or taking inventory of what are some things that I really could benefit from having an outside person come in and provide some support or assistance, and then reaching out. Eileen talked about their senior line. That's just a very broad resource for people that are needing help with something and may not know exactly what you need help with, but just calling and reaching out and saying like, things are not going well and I need someone to help me with X, Y, and Z. And making that phone call can make a huge difference.
So it doesn't have to be even a weighty conversation. So if you are at lunch with your stepmother, like, okay, Happy New Year. What do we think? What would make this year better than last year? And there may not be any big issues, but if there are, they might bubble up in that conversation. So just, I think when you say what's one small step, I love the self-assessment. And then if you're talking about how do you support somebody else, you're already doing it. Making a coffee date or a lunch date with somebody and just having that, what could be better and how can we make it that way?
Yeah. So it comes full circle. Why is this conversation important now? And it's a great time to take these steps that you two are talking about. This has been great. And as I have been listening to you all, I'm thinking, who needs to hear this? Who needs to be targeted with this message? I think that in the past, I would think to myself, well, my stepmother needs to hear this message. And as we've talked, I've realized, no, I need to hear this message. This is for me. And so I think this is a really great conversation, especially for people who are caregivers or who have parents or relatives or whatever who may be getting a little older. I'm really glad that you all could be here with us to share this. So anything else before we wrap up today? Did I miss anything? Did I forget anything?
Chris, I couldn't agree with you more. I was just listening, like, oh my gosh, who are the seniors in my life or the older adults besides my mom and stepdad that I need to reach out to and just say thank you? We talk about caregivers, and this senior population, this older adult population is cared for us as we have grown up and come into the working world, and turnabout is more than fair play. And so it's just, it's amazing that we forget that sometimes.
Yeah.
So.
Yeah.
And also, I love that lens. How can we make it better for people? Maybe we're not their caregiver, but they're in our lives. But turning the lens back on ourselves. I'm not going to ask anybody at the table how old they are. I am 62. And what are the things I can be doing now as I am aging that set me up for success? So the message is to Chris, the caregiver, but it also could be to Chris, the 55-year-old.
Person who's getting older, yeah.
Right. So because it's a process, right? It's not a switch. And so what are we doing today to make our aging years better?
Yeah.
If you start earlier, making those plans and thoughts and good habits,
That's a great point.
We do that with our finances, or hope to.
Yes.
Why wouldn't we do that with,
Exactly.
Mental health.
what the transition in life is? The second chance that we talked about earlier.
Redeployment.
Redeployment.
That's
Love
right.
that.
All right. Well, thanks everyone for being here today. Appreciate it.
Thanks for having us.
Thank you.
Yeah.
Thanks for tuning in. If you found value in what you heard today, there are a few ways you can support and stay connected to us. First, be sure to hit that subscribe button wherever you're listening to us. Subscribing ensures you never miss an episode, and it's absolutely free. It also helps us continue bringing you quality content. Consider leaving us a review. Your reviews not only make our day, but they also help others discover the podcast and join our community. Share this episode with friends, family, and anyone who might find it interesting. Word of mouth is a powerful way to grow our podcast family, and we truly appreciate your support. We're always eager to hear your thoughts, ideas, and suggestions. Email us at communications@fcsok.org with any episode ideas or questions. We'd love to connect with you. To learn more about Family and Children's Services, visit fcsok.org. Until next time.